Hello, my name is Dr. David Morgan, and for over 35 years, I've had the privilege of walking alongside older adults, listening to their stories, caring for their health, and perhaps most importantly, hearing the quiet things they often don't tell anyone else. Today, I want to talk about one of those things, something deeply personal, rarely discussed, but incredibly important to your health and quality of life. But before we begin, if you care about staying healthy, independent, and mentally sharp as you age, please take a moment to like this video and subscribe to the channel if you haven't already. We create thoughtful, respectful content designed specifically for people in their 60s, 70s, and beyond. And if what I share today resonates with you, type the number 1 in the comments. If it doesn't, type 0. Your feedback helps me create better support for you and others. Now, let me ask you something quietly, gently. When was the last time you really felt connected to your own body? I don't mean taking your vitamins or getting your steps in. I'm talking about something more intimate, the act of touching yourself, of honoring your body not as something broken or old, but as something still alive, still worthy of care. Over the years, I've had patients, strong, intelligent, good people look me in the eye and say, "Doc, I just figured that part of me was over." And it breaks my heart, because what they're really saying is, I stopped seeing my body as something that matters. And that's never, ever true. In today's video, I want to walk you through 7 real consequences I've seen in patients who stop masturbating later in life, not out of shame, but out of misunderstanding. We'll talk honestly without judgment about how this natural act supports not just sexual health, but also brain clarity, sleep, emotional balance, and even immune strength. This isn't about fantasy or indulgence. This is about health, dignity, and reclaiming connection with yourself. Because even with silver hair and slower steps, your body still speaks and it deserves to be heard. 1. Declining prostate health and urinary trouble. Let's start with something I see far too often, and yet it's rarely talked about. A man in his early 70s, fit, intelligent, still walking his dog every morning, comes into my office. He's not complaining about pain or energy. He just looks tired. "Doc," he says, "I'm up 5 times a night just to pee. I don't drink much water before bed, but I still wake up constantly." And what he doesn't realize, what most men don't, is that this isn't just about aging. It's about neglecting the prostate. And that neglect often begins the moment they stop touching themselves. You see, the prostate isn't just sitting there like some passive part of the plumbing. It's a dynamic organ. It produces fluid, contracts and relaxes, and like any living system, it needs movement to stay healthy. When you stop ejaculating, whether through sex or solo stimulation, fluid begins to stagnate. That stagnant fluid can trigger inflammation, swelling, and pressure in the prostate. And that pressure doesn't just sit quietly, it presses on the bladder, slows your stream, creates that constant full feeling, and robs you of restful sleep. Worse still, chronic congestion in the prostate can lead to benign prostatic hyperplasia, or BPH, a condition that affects nearly half of all men over 60. Left unmanaged, it can lead to infections, urinary retention, and in some cases, even require a catheter. But here's the good news. Regular ejaculation, yes, even through self-pleasure, is one of the simplest, most natural ways to flush out the prostate and support healthy function. One large study even found that men who ejaculated 21 times a month or more had significantly lower risk of prostate cancer. This isn't about reliving your youth or chasing fantasy. It's about maintenance, like stretching your back or brushing your teeth. And when men ignore this part of their health, what begins as a bathroom nuisance can slowly chip away at freedom, confidence, and peace of mind. But here's the twist: what starts in the prostate doesn't stay there. Because the next consequence doesn't just affect your body. It affects your brain, your clarity, your memory, and even your sense of identity. Let's talk about that next. 2. Brain fog and declining mental clarity. Not long ago, a patient in his late 60s came to see me. He wasn't complaining about pain. His energy was decent. His labs were fine. But he looked at me with a quiet mix of concern and vulnerability and said, "Doc, I just don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my train of thought mid-sentence. I used to be so sharp. What's happening to me?" It's a question I hear more often than you'd expect. And while yes, aging does naturally bring some cognitive changes, what no one tells you is this. Stopping masturbation, especially for months or years, can gradually starve your brain of essential support. You see, during orgasm, even alone, your body releases a powerful wave of neurochemicals. Dopamine improves focus and motivation. Serotonin regulates mood and memory. Oxytocin fosters connection and emotional balance. And at the same time, it lowers cortisol, the stress hormone that can cloud thinking and damage brain cells. These chemicals aren't just feel-good extras. They're your brain's maintenance crew. They build neural connections, stimulate blood flow, and keep your mental gears turning smoothly. But when sexual activity disappears, so do those natural chemical boosts. And over time, things get fuzzy. You forget names. You lose your words. You wake up feeling mentally blank. And then, more dangerously, you start to doubt yourself. I've seen this spiral. One man quit going to his chess club, said he couldn't concentrate. A retired teacher told me mornings felt like staring at a wall. She couldn't find her thoughts. They weren't sick. They were disconnected. Disconnected from their bodies. Disconnected from the very act that could restore their mental sharpness. All because they believed it was no longer appropriate to touch themselves. But here's the truth. Sometimes what the brain needs most isn't a pill, it's a signal. A reminder from the body that we're still here, still alive, still capable of feeling. But what happens when the brain isn't just foggy but numb? What if you don't feel sharp but you don't feel anything at all? That's what we'll explore next, in consequence number 3. Emotional numbness and the quiet rise of depression. And he'll share a story from a man who looked me in the eye and said, "I don't feel happy. I don't feel sad. I just don't feel anymore." 3. Emotional numbness and the quiet rise of depression. I once sat across from a man in his early 70s, a widower, retired, relatively healthy, but there was something in his eyes that told me this was the typical checkup. He was in physical pain. His blood pressure was stable. His heart sounded fine. But when I asked, "How are you really feeling these days?" he looked down for a moment and then said something that stayed with me ever since. "I don't feel anything anymore. Not sadness, not joy, just flat." And then he asked the question so many silently wonder, is that normal at my age? And my honest answer? No, it's not, but it's also not uncommon. You see, there's a quiet, invisible shift that can happen when someone gives up on physical intimacy, especially with themselves. It's not just about losing desire, it's about losing connection. Masturbation isn't just a physical act. It's a release emotionally, chemically, neurologically. During climax, your brain releases a surge of oxytocin and endorphins, the very chemicals that combat anxiety, tension, and low mood. They help you feel grounded, alive, human. When that's taken away, not for days, but for weeks or years, the emotional system starts to dry out. People become quieter, less expressive. They lose interest in hobbies and conversation. Some sleep too much. Others can't sleep at all. And life starts to lose its color. The tragic part? They don't connect the dots. They think, maybe this is just what getting old feels like. But really, they're grieving the loss of connection with their own body. And here's what I've seen time and again. When that connection is gently restored, the spark begins to return. Not in a dramatic Hollywood kind of way, but in small, meaningful shifts. A bit more laughter, a bit more energy, a reason to get dressed in the morning. One man told me, "I didn't realize how much I miss feeling something until I did." This isn't about lust. It's about emotional survival, about giving your nervous system a reason to feel, to care, to come back to life. But there's more to this than emotion, because when that release is gone, something else suffers too. Something that touches every cell in your body or sleep. Let's talk next about how the absence of sexual release may be quietly robbing you of deep, restorative sleep and what you can do about it. 4. Poor sleep and declining sleep quality. I remember a man named Carl, 68 years old, a retired engineer with a sharp mind and kind eyes. But when he sat down in my office, I could see it in his face. Exhaustion, the kind that settles deep. "Doc," he said, "I fall asleep fine. But like clockwork, I wake up at 2 a.m., wide awake, heart racing, and I just lie there, staring at the ceiling, waiting for the morning. We ran all the usual tests. No sleep apnea, no thyroid issues, no alarming labs. Then I asked him gently, "Carl, have you had any physical intimacy lately? Even with yourself?" He looked away, then shook his head slowly. That part of me, I guess I thought it was done. But what Carl didn't realize, and what many don't, is that the part he believed had shut down might have been exactly what his body was missing to get the rest it so badly needed. You see, sleep isn't just about closing your eyes. It's a complex hormonal shift, and one of the most natural triggers for deep, healing sleep is orgasm. During climax, your body releases oxytocin and prolactin, promoting relaxation and trust, endorphins, soothing stress and tension, and it lowers cortisol, the stress hormone that keeps you alert and anxious. Together, these changes signal your nervous system. You're safe. You can rest now. Your heart rate slows. Your muscles soften. Your brain eases into a rhythm that allows for deep, restorative sleep. When older adults stop masturbating, they unknowingly remove one of their body's most effective tools for sleep. In its place, restlessness, tossing and turning, racing thoughts. Some reach for sleeping pills. Others just assume they're getting old and resign themselves to feeling drained. But sometimes it's not aging. It's biology missing a signal it used to rely on. One patient told me, after gently reintroducing intimacy with himself, "Doc, I slept like I did 30 years ago. I didn't know how badly I needed that release." 5. Weakened pelvic floor and poor circulation. Several years ago, I met a retired firefighter named James Proud, strong, the kind of man who once ran into burning buildings without hesitation. But when he came to see me in his 70s, he was concerned not about his heart or lungs, but about something quieter and harder to admit. "Doc," he said, "I'm starting to leak a little when I cough, and when I stand for too long, my lower back and hips just ache in a way they never used to." Then he paused and added, "It feels like the foundation of my body is giving out." What James was describing wasn't weakness in his muscles alone. It was the gradual erosion of his pelvic floor. And he wasn't alone. The pelvic floor is a group of muscles at the base of your body muscles that support your bladder, bowels, and sexual organs. Most people never think about them until they stop working. You may notice sudden urges to urinate, dribbling after going to the bathroom, trouble holding in gas, discomfort when sitting or walking, or for men, a quiet drop in sexual function that's hard to talk about. But here's the important part. Regular sexual activity, including masturbation, helps keep those muscles active. During arousal and orgasm, your pelvic floor contracts rhythmically, just like any other exercise. This stimulation increases blood flow, keeps nerves responsive, maintains muscle tone, and protects against atrophy. When you stop stimulating this part of your body, everything slows down. Blood doesn't flow as well. Tissue loses elasticity, and over time, your base of support, the literal foundation of your body, begins to weaken. I've seen once independent older adults suddenly feel anxious about long car rides or walks in public, not because of illness, but because they no longer trust their bladder. And worse, they blame themselves. Or worse yet, they accept it. This must be what aging is. But I'll say this clearly. Losing strength and control isn't inevitable. And it's certainly not shameful to want that part of your body to work again. Because when you reconnect with this region, even in small private ways, you're not chasing pleasure. You're protecting dignity, mobility, and confidence. But as physical as this is, the next consequence goes deeper. Because when you lose stimulation here, your entire immune system begins to slow. And that means more colds, longer recoveries, and even higher risk for chronic disease. Let's talk next about consequence number 6, how sexual inactivity can quietly weaken your immune system and what you can do to bring it back. Let me know when you're ready. I'm happy to continue. 6. Weakened immunity and increased illness. One chilly winter morning, I sat down with Pierre, a longtime patient of mine, 69 years old. He'd always been healthy, the kind of man who rarely caught a cold, bounced back quickly, and prided himself on staying active. But this time was different. In just 3 months, Pierre had come in 3 separate times for fatigue, lingering coughs, and minor infections that just wouldn't go away. "Doc," he said, rubbing his temples, "I used to shake these things off in a couple of days. Now even a little cold knocks me out for a week. What's going on?" We checked everything. His nutrition, his sleep, his medications, all looked reasonable. So I asked him something most doctors never think to ask. "Pierre, have you had any physical intimacy lately? Even just with yourself?" He chuckled awkwardly, then shrugged. "Honestly, that part of me retired a while ago." But what Pierre, like many others, didn't know is this. Sexual activity, including masturbation, has a direct effect on your immune system. And no, this isn't poetic, it's biological. When you experience orgasm, your body releases more than just feel-good chemicals. It also produces substances that actively support immune health. Immunoglobulin A, IgA, a frontline antibody that defends against viruses and bacteria, especially in your respiratory and digestive systems. Endorphins, natural anti-inflammatories that help the body recover and repair. Now imagine going months, even years without those immune signals. Your body slowly loses one of its simplest, most natural defenses. And in older age, when immunity is already declining, this loss matters even more. I've seen it again and again. Older adults who once bounced back quickly start getting sick more often, recovering more slowly, or dealing with chronic inflammation they can explain. And rarely do they connect the dots. They think it's just aging, but their bodies are trying to tell them, "I need you to care for me again." One woman in her 70s, after years of complete physical withdrawal, said this to me after reconnecting with her body. "I wasn't doing it for desire. I did it for health. And somehow I feel like my body is working with me again, not against me." That's not magic. That's the body responding to attention, presence, and touch. And that brings us to the final and perhaps most important consequence of all, because when you stop touching your body over time, you may stop feeling like you live in it at all. Let's talk next about consequence number 7, losing connection with your physical self and how that quiet erosion can affect your confidence, your identity, and your will to live fully. Are you ready for the final chapter? It'll continue whenever you are. 7. Loss of body connection and the quiet erosion of self-worth. I'll never forget a routine checkup with a man named Michael. He was a retired school principal, once confident, quick-witted, and the kind of person who seemed to light up every room he entered. But on this day, something was different. His shoulders were slightly slumped. His eyes didn't quite meet mine. As we spoke, I gently asked, "How are you feeling these days, really?" He paused, looked down, and said something that has stayed with me ever since. "I don't feel like I live in this body anymore. I feel like I'm just inhabiting it." And I've heard that in different forms from so many others. I don't feel like a man anymore. I don't feel like a woman. I avoid mirrors. I dress for comfort, not because I care how I look. No one really sees me anymore, not even me. What they're describing, even if they don't know it, is this. They've stopped feeling at home in their own skin. And that detachment almost always begins when they stop touching themselves, not just physically, but emotionally and mentally too. Not because they can't, but because they've convinced themselves that it's too late, not appropriate, or no longer worth it. But the truth is this. When you stop touching your body, you don't just lose pleasure. You slowly lose the feeling that your body still belongs to you. That loss often leads to letting go of personal care, skipping meals or eating mindlessly, abandoning exercise, dressing without intention, and worst of all, feeling invisible even to yourself. One woman once said to me after menopause, "I stopped touching myself and slowly, I stopped feeling like a woman. The less I touched, the more I disappeared." That word disappeared hit me like a wave, because that's exactly what I've seen happen again and again in people who believe their body no longer matters. But here's what I need you to know. Reconnecting with your body through self-touch is not about lust or fantasy. It's about reminding yourself that you are still here, that you still have a pulse, that you still deserve care even if it comes only from your own hands. When you touch your body with presence, you come home to yourself. You begin to reverse the silent message that says you no longer matter. And maybe that's the most important truth of all. We've talked about your prostate, your mind, your sleep, your emotions, your immune system, your circulation. But above all, what you stand to lose when you abandon intimacy with yourself is the belief that you are worth caring for. Let me tell you now clearly and gently, you are. At 60, at 75, at 90, you still deserve to feel, to be seen, even if it's just by you, in the quiet of your room, with no one else watching. Finally, looking back on the thousands of patients I've met over the years, men and women in their 60s, 70s, 80s, and beyond, what stays with me most isn't the lab results or diagnoses. It's the quiet losses they carry. A man who used to feel confident now avoids mirrors. A woman who once moved with ease says she hasn't felt anything in her body for years. And far too often, they've been told directly or silently that this is just part of aging. But I don't believe that. And if you've watched this far, I don't think you do either. Because here's the deeper truth. The moment you stop caring for your sexual self, the moment you abandon that connection with your body, a slow unraveling begins. Yes, the physical effects are real. Your prostate, your brain, your sleep, your immune system all can suffer. But so can your sense of identity, your emotional strength, your feeling of being fully alive in the body you still inhabit. But it doesn't have to stay that way. You don't need to be young. You don't need a partner. You don't need permission from anyone but yourself. What you need and deserve is the reminder that your body is still yours, still capable, still deserving of tenderness, attention, and care. Reclaiming that connection isn't shameful. It's healing. It's life-affirming. It's an act of self-respect. If you've forgotten this part of yourself, or buried it, or judged it, I invite you to begin again. Gently, privately, kindly. Not for anyone else, just for you. Because when you reclaim your intimacy, you reclaim your health. And when you reclaim your health, you reclaim your life. If this message spoke to you even a little, please don't keep it to yourself. Like this video. Share it with someone who may need to hear it. And if you feel comfortable, leave a comment below, even just the number 1, to let me know you're still here. Still listening. Still caring. Because your voice matters. You matter. Thank you for being here. Take care of yourself truly.